Yeah, so this is an editorial that I wrote in conjunction with an article published by Jonathan Friedberg in Blood earlier this year. So those authors published the long-term follow-up of a study of Brentuximab vedotin and Nivolumab in untreated Hodgkin lymphoma in patients who were not candidates for intensive chemotherapy. And so, what they saw in this 22 patient study was that response rates were high, and approximately half of these patients seemed to have a durable remission at this median follow up of 4 years. And so, again, with the caveat of a small study, it was a very intriguing result because traditionally it has been thought that patients need to receive a fixed amount of an anthracycline-based chemotherapy in order to achieve a cure. But in this particular study, in patients who were not candidates for that, nearly half of the patients did have a long-term remission and perhaps have been cured. And so I think this fits a theme throughout the Hodgkin lymphoma community, which is trying to better optimize and tailor treatments for patients with Hodgkin lymphoma with the hopes of reducing both short and long-term toxicity. Over the past decade and longer, there's certainly the long-term toxicities of radiation and even anthracycline-based chemotherapy have been observed in a dose-dependent manner. And so I think over the coming years and likely decades, I think as a field, we can try to move towards reducing the treatment burden for patients by utilizing some of our newer tools like ctDNA and baseline genotyping in order to determine which patients truly need the more intensive treatment to achieve a cure and which, perhaps the majority of patients, might be able to be cured with less.